Diverticulosis. Your digestive tract has an important job. It breaks down all the food you eat into the nutrients your body needs to survive. Sometimes small pouches can form inside the lower part of the tract. If you have many pouches, this is called diverticulosis. Diverticulosis happens when the inside layer of the tract pushes out through a weak spot. A single pouch is called a diverticulum. These pouches can form anywhere in your lower digestive tract. Most often they form on the left side of the large intestine or colon. This is where stool collects before you have a bowel movement. Causes. Doctors don't know why some people get these pouches. You are more likely to get them as you get older. It's rare under age 40, but more common over age 60. Eating foods with a lot of fiber, like fruits, vegetables, and grains, may be one way to avoid getting these pouches. Some studies show that people who live in countries where they eat a lot of these foods don't get it as often. Other studies show that low fiber may not be the cause at all. But you should eat lots of fruits, vegetables, and grains anyway because they help your body stay healthy. Your family health history may play a role. The condition runs in families. If you don't get enough exercise, you may increase your risk too. Symptoms. If you have diverticulosis, you may not have any symptoms, but some people get symptoms such as crampy lower belly pain, especially on the left side. Bloating, a change in bowel habits, especially constipation. If you have these symptoms regularly, make sure to tell your healthcare provider. Diagnosis. Since diverticulosis often has no symptoms, you may not know you have it until you are tested for another problem. It may be found during a test called a colonoscopy. This is a screening test for colon cancer. Tests to diagnose diverticulosis include a barium enema or a special X-ray of the large intestine, including the colon and rectum. A CT scan, which is a series of computer-guided X-rays of the colon. An abdominal ultrasound, where sound waves are sent toward the colon to create a picture on a video monitor. Treatment. If you have symptoms, your healthcare provider may tell you to eat high-fiber foods. A good amount of fiber is about 35 grams per day. Your healthcare provider may also tell you to take a fiber supplement. These can help your stools become softer and easier to pass. What to do? If you have diverticulosis, let your healthcare provider know if you have symptoms. Make sure you eat enough fiber and drink lots of water, and get lots of exercise. The most common problem is when one or more of the pouches gets inflamed. This is called diverticulitis. It can be painful. Symptoms can include belly pain and fever. Let your doctor know about these symptoms so you can be treated. What we have learned. Most people who have diverticulosis have many symptoms. True or false? The answer is false. Diverticulosis is when small pouches form in the lower digestive tract. True or false? The answer is true. When one or more of the pouches gets inflamed, this is called diverticulitis. True or false? The answer is true.